Are you a podcaster? Maybe you've got that big idea and you're looking for a network to join. The multi-award-winning Ozcast network can get your content to eyes and ears all over the world. Join now for the first month free, and you could be featuring this sound at the beginning of your podcast.
Ozcast.
Simply head to ozcastnetwork.com for details.
Wavelength.
The real issue with data privacy is who's collecting your data behind the scenes, so in the back end of it, and who is that being shared with.
Sparking the combos about Adelaide.
It's every woman's choice. If they choose to have an abortion, then so be it.
You should be having...
These issues need to be properly investigated, and we need to make sure that LGBTIQ people are supported to be who they are.
On Fresh 92.7.
Welcome to Wavelength, sparking the convos about Adelaide you should be having. I'm your host, David, and wow, what a week. Tonight on Wavelength, the team has put together a very special COVID-19 edition of the show. If you've been listening for a while, you'd know that every week we do a coronavirus explainer about what's been happening around the world. Well, this week, coronavirus came to Adelaide and threw everyone into a panic. We've gone from the strictest lockdown in the world and right back out of it in just a matter of days. Businesses are hurting, but the good thing is we're mostly all healthy and safe now. Originally, we were going to do a lockdown special, but things have changed. Nonetheless, we'll be hopefully answering many of your questions about the crisis, including more about the certain strain of COVID-19 in Adelaide, whether the hotel quarantine system is broken, and generally what made SA Health declare that insane lockdown period. I hope you're ready for a good ride. We'll be getting into the meat of the show soon, but for now, you're listening to Fresh 92.7.
Wavelength.
Welcome to Wavelength for a very special COVID-19 edition of the show. Before we ask the questions about what on earth happened this week, we need to take a step back and see where we've been. Here's Andrew for a quick rundown of the insanity of the past 7 days.
Wavelength on Fresh 92.7.
Just over a week ago, we were all taking sunny trips through the hills, hitting the beach and getting in plenty of retail therapy, not really considering the risk of COVID-19. Now, well, things are a little different. Restrictions are back in place and we've just emerged from one of the harshest, albeit brief, lockdowns around Australia and maybe even the world. So how exactly did we get here? Well, let's run through the timeline. Sunday before last saw health authorities announce a number of new cases from what was quickly labelled the Parafield Cluster. It was discovered after an 80-year-old woman tested positive at the Lowell McEwen Hospital, with the virus also found in 2 family members. By Monday, the panic buying was already kicking in. Toilet paper, pasta and long-life milk were all stripped from the shelves, leaving many people unable to buy the essentials. As 17 new cases were announced, most of which are from that same family, many states and territories wasted absolutely no time in closing borders to SA. With the cluster growing quickly, new restrictions including the closure of gyms and caps on gatherings came into force, while inbound flights to Adelaide were mostly cancelled. From a prison to an aged care facility, the cases seemed to be all over the show, and people quarantining at Pepper's Hotel were also told they'd have to quarantine for another 2 weeks as a precaution. Now, fast forward to Wednesday, this was a crucial day. The Premier announced from Thursday we'd go into a 6-day so-called circuit breaker lockdown, firstly to stop the spread of the virus and also to allow for further contact tracing. This came about amid concerns over a hotel quarantine worker having bought a pizza from the Woodville Pizza Bar. From there, authorities believed it could have spread to thousands of people. And, well, come Thursday, the first day of the circuit breaker, and there was just 1 extra case reported. People couldn't leave their homes and the roads fell pretty much quiet. With around 20,000 tests in the previous 2 days, however, authorities were praising people for coming forward. But, well, as we know, Friday was where everything changed. At the daily press conference, it was announced that the very person who sparked the lockdown in the first place had actually lied to contact tracers. While the 36-year-old man had said he was a customer of the Woodville Pizza Bar, he had in fact been working there. This led the Premier to announce the circuit breaker would end at midnight Saturday, with businesses to reopen, while people could also exercise outside immediately. Understandably, there's been plenty of anger from the public, with an investigation into the issue ongoing. Well, come Saturday, plenty of people were out exercising despite the heat, and just 1 new case is recorded in someone who had already been in quarantine. Meanwhile, yesterday we also learned of another new case, a returned traveller from overseas with no links to the cluster. Both the Premier and Chief Public Health Officer Professor Nicholas Spurrier are now relatively optimistic about the situation, but it's still very much up in the air. Here's what the Premier had to say yesterday.
I know that this has been a very challenging time for the people of South Australia, but we have avoided avoided a catastrophic situation in our state by following the unequivocal health advice. But I do need to emphasise that we still do have high-level restrictions in place over and above where we were at this time last week.
Well, that's the week that was in the Parafield Cluster. Cases were always expected to spring up, but I don't think any of us thought it would be quite to this extent. Who knows what the next couple of weeks will bring, but from all of us at Fresh, please take care, stay safe, and get tested if you have any symptoms whatsoever.
Wavelength, sparking the convos about Adelaide you should be having on Fresh 92.7.
Thanks for that, Andrew. Coming up after the break, Hamish will be speaking to an infectious disease expert about Adelaide's situation. You're listening to Fresh.
Wavelength.
Welcome back to Wavelength with just me, David, tonight. Hope your Monday has been treating you well. So this week was wild and you've probably got plenty of questions. Thankfully, Hamish is here to help. He spoke with infectious disease expert Professor Nigel McMillan about everything COVID-19, from the Adelaide cluster to vaccine developments.
Wavelength on Fresh 92.7.
The last week has been one hell of a ride, Adelaide, and I know most of you are still reeling. Safe to say you probably have just as many questions as ever at the moment, and luckily I was able to track down Professor Nigel McMillan, the Director of Infectious Diseases and Immunology at Griffith University, to chat all things COVID. We began by discussing the latest lockdown, the likelihood of it happening again, and the false information that started it all.
I think what led to that action was the nature of the people who had the infection. You want to keep it out of institutions where people congregate, and I think there was a bit of that led them to think that this could really get out of hand quickly. So look, always better to act early and decisively. If Victoria had done that 3 weeks earlier, their lockdown would have been, 6 weeks shorter, sort of thing. We had a sort of similar situation, not quite as drastic, where the truth wasn't quite told. So it does have consequences, and I think there's all sorts of reasons why people don't tell you the right thing when you're doing contact tracing, and some of it's quite personal and private, and fear of being caught working in a job you're not meant to be working in, or cashies or whatever. Well, really, honestly, the health department don't care about any of that. It is better to err on the side of caution in these cases. But I think as time goes on and we get more experience with this, and each state gets more experience, I suspect next time, we probably might not pull the trigger quite so quickly. New South Wales, as I said, is really an example of a state that's embraced the, suppression strategy. So they would have not done this. They would have had this outbreak. They would have ruthlessly done contact tracing, and they would have isolated those 3,000 or 4,000 people they thought were going to be in contact. They would have locked those places down and waited for the requisite 2 weeks. Because 6 days was always very strange. It didn't make any sense from an infectious diseases point of view. There's a reason we keep people for 14 days, and that's because ultimately about 95% of people, if they're infected, will show symptoms by 14 days.
Nigel then offered up his thoughts on the response in SA and whether it was too drastic and how our response differs to the other states.
As we go forward, we've got to start getting a better middle ground of practice, I think. Locking the whole state down for 6 days, in a situation like you had, while going early is always better than going late. It was probably, in hindsight, a little bit extreme. But, we're not paid to make those decisions. And if you're wrong, then there's a lot of pain at the other end. If you look at New South Wales, probably, the only state, I think, right now who's really being able to keep things going and deal with the cases as they come along, do their contact tracing, isolation, and quarantining. So every state's got quite a different scenario. I mean, lots of states slam their borders on SA, once again, probably in a bit of a knee-jerk reaction. Queensland's probably one of the worst offenders in that sense, or WA is probably the worst. But, in the end, it's brought, this whole pandemic's brought to light some interesting ways that our federation works. We really can't centrally organise these things properly because of the way the states and the feds are set up, through our constitution. Well, what the federal government, I guess, is trying to do is to get the states to agree on a common set of principles by which we can all sort of bank on.
Nigel then gave me the lowdown on everything to do with vaccines, how close we are to getting one, how safe it is, and who will get it first.
So I think that one thing that this pandemic has shown us is that the way that we can make vaccines much more quickly than we have been in the past.
Yeah.
And so there are at least 65 vaccines in clinical trial being tested in people right now, but there are probably 4 big ones that are ahead of the others. So how confident I am? We're going to have a vaccine delivered to our shores in January. I don't doubt that will happen. It will be a completely new vaccine technology. So this will be the Pfizer vaccine. It is based on a technology which is called mRNA. It's basically something that we can we build a genetic instruction from the virus and put it into a little lipid fat ball and inject it in, and it makes just one virus gene, so it doesn't make whole viruses. And the immune system sees it and reacts. This has turned out to be pretty safe. The major side effects seem to be the typical vaccine side effects of headache and maybe a slight temperature and a bit of redness in the arm.
Yep.
So that's not in any way unusual. Our best vaccines have about a 1 to 1 million to 1 in 10 million chance of a serious adverse event. That's where someone needs hospitalisation. They have a serious, immune reaction to it, like an anaphylactic shock or something like that.
Yeah.
And deaths from vaccines do occur, but they're pretty rare. Obviously, the death from a vaccine is much lower than the death from COVID, which is in about 1% at the moment. So we'll have the vaccine on shore and available. They won't be widely available until I don't think everyone will be able to get their hands on one, probably more till the end of the year when more vaccine supplies come online. This interesting article came out today about vaccine hesitancy, who would get the vaccine. So about 60% of Australians have said they'll take it. Yep. About 30% said they will wait and see. And I think they're just waiting for the clinical data to see that it's safe and effective, and that's pretty reasonable. And there's about 7% of people who said they won't take it, which is pretty much on par with every other vaccine we take. There's a very hardened group of anti-vaxxers, which is less than probably 1% who don't want to take it. But there's certainly a group of very health conscious people who have hesitancy about taking vaccines. If we get 90% of people vaccinated, we'll be fine. This vaccine shouldn't be mandatory. By vaccinating all our old people, we will stop people dying from this disease. All the deaths essentially in the over 65s. So just merely by vaccinating them, we'll eliminate most of the deaths straight away, which will be good. Healthy young people could get vaccinated because obviously that would stop the virus circulating around to old people. Kids don't need to take it at all. They seem pretty much bulletproof on this one. The federal government has put together a bit of a plan on what they think are the priorities. But I think generally most people agree that you want to first of all vaccinate your most vulnerable. So that's basically our old population, our elderly people, as I said, because that's where all the death is. People who have diabetes seem particularly susceptible to this disease. There seems to be people who are morbidly obese are actually quite susceptible to this disease. So that would be the first cab off the rank, as well as obviously the people who care for them. So aged care workers, hospital, ambulance, first line workers. I put a vote in, of course, for the researchers who actually work directly with the virus in the lab. That would be a good group to vaccinate. But your I'd say nurses, paramedics, and things like that. That'd be next off the rank. And after that, then you'll work your way down to teachers, daycare, people like that, and then general population. you can see the sort of reactions we have now. We're following every case every day. We have reports in each state. What's our scorecard? Have we got a case? Is there a positive case in a hotel somewhere? And we want to get to a point where this is something we don't even think about. So I think that normalcy, to me, will get the bulk of our vaccination, I think, sorted out by the end of 2021. That would probably be a pretty ambitious timetable, but I think doable. Australia is very good at organising things, I can tell you that. And so I think normality really hits in 2022. Normal air travel, normal interstate, going out, sporting matches, crowds, things like that. And then what does normal look like? I think normal looks like the flu. That is, this virus is going to be around now for a long time. If we get 90% of the population vaccinated, it'll have a very hard time circulating. So it'll just pop up every now and then. Some old people will die from it because their immune systems are, worn out, and that's what happens with the flu. Every week, 2,000 old people die from the flu every year in this country. Yeah. Have for many years. It's just not something we particularly concern ourselves about in particular, other than, when you're very, very old, you just become very susceptible to infections of all kinds. And it'll just be like the flu, and you'll get your jab, hopefully once every 5 years. You might need a booster for this particular vaccine. We'll see. The only time we'll be able to tell.
Finally, we spoke about what it means to start looking forward if a return to normality is on the cards, and what normal looks like in a post-COVID world.
Many things have changed with this pandemic. So things that we didn't think were possible before are now possible. So things like working from home. The NBN in reality has been the best pandemic investment this government ever made, because without it we wouldn't have been really able to work from home or be productive from home. And so our work practices will definitely change. I think companies will probably leave inner city offices or reduce their footprints in inner cities to do that, and will change the way it works. Socially, I think that people will be wary about social distancing for a couple of years, but I think in the long run we'll forget. I think people will just go back to their old habits. So in 5 years' time, you'd look and you probably won't notice. I think we've got to start thinking along the lines that having a case is not a failure, it's an expectation. We're going to have this virus forever now, and cases will come, and we'll deal with them.
Wavelength, sparking the convos about Adelaide you should be having on Fresh 92.7.
Thanks for that, Hamish. Coming up later, we'll get you up to speed on some news you might have missed this week in the world of politics. You're listening to Fresh.
Wavelength.
Welcome back to Wavelength for our very special COVID-19 edition. In the chaos that was this week, you'd be forgiven for missing some of the major headlines. Our resident political head, Hamish, has you covered though. Let's find out now what the hell is going on with politics this week.
What the hell is going on in politics at the moment? Wavelength on Fresh 92.7.
While the headlines here in SA were dominated by the news of our harsh and short-lived lockdown, things continue to tick along around the rest of the country, so I'll catch you up on what you might have missed. Over 400,000 Australians affected by the unlawful Robodebt scheme will finally receive compensation from a $1.2 billion court settlement. Gordon Legal, who have been handling the class action lawsuit, confirmed that they hope to finish distributing payments to individuals who paid the illegal Centrelink debts between 2015 and when it was halted in 2019. Meanwhile, the Morrison government is attempting to walk back its commitments to increasing superannuation guarantees for everyday Aussies. A recent review from Treasurer Josh Frydenberg's office outlined how Australians should instead rely on voluntary savings ahead of a compulsory superannuation increase, which allegedly needs to be closely considered due to the economic impact of the pandemic. Also in the news, sweeping reforms to archaic laws surrounding licensed venues in New South Wales were thrown out of state parliament this Tuesday, much to the relief of the state's live music industry. Some of the outdated laws included only cover bands being allowed to perform in certain pubs, while other establishments can only have bands perform outdoors while facing south, and even disco balls were banned in select venues. Finally, Australia and Japan agreed to a defence pact to increase military ties this week, and the recent report on Australian war crimes found that Special Forces murdered at least 39 Afghan civilians. And that's what the hell's been happening in politics this week.
Wavelength, sparking the convos about Adelaide you should be having on Fresh 92.7.
Thanks for that, Hamish. Hope you're all enjoying the show so far. We'll have more on Adelaide's COVID-19 insanity coming up after the break. But for now, you're listening to Fresh.
Wavelength.
Welcome back to Wavelength, sparking the convos about Adelaide you should be having with your host David this evening. So our lockdown was pretty uneventful and cut quite short, but it doesn't mean that we won't go back into a lockdown if another cluster emerges. So how do you keep mentally healthy during these periods of upheaval and uncertainty? Amila had a chat with our favourite medical health professional, Dr. Lane, to find out more.
Wavelength on Fresh 92.7.
With the frantic lockdown last week, it's definitely left many of us drained and worried about what lays ahead. So while thousands of Adelaideans are in quarantine and the rest of us practice caution, checking in with our state of mind remains important. I had a chat to Dr. Lane about how this pandemic has impacted people and the support available after what's been a tumultuous year.
Obviously, the uncertainty of what's happening at the moment, where we're going to be in 6-12 months down the track, is placing a lot of stress on people, and that external sort of pressure of the environment that we can't really change at the moment is very hard for a lot of people in terms of their financial security and their family. But I guess the other thing is that being isolated, whether it be during the lockdown that we've experienced this week or whether it's been more broadly in terms of border closures and that, has been really hard for people again, because a lot of people have been separated from family or friends or just feel that distance a lot more.
And although this lockdown was shortened for most of us, thousands of people still have to quarantine. So how will those 2 weeks impact them mentally?
Well, quarantining, it's very hard on people's mental health, and I think to be fair, everybody knows that. The medical profession knows that. The SA Health and Public Health departments are very aware of it. It's an unusual time in that for the physical health of the population and individuals, it's a necessary thing to do, but it is a very hard thing because it goes against our general, I guess, social instincts to be isolated, not only from other people, but in one space. So it is going to be a hard time, and I know that there are certainly things available. There are supports available for people who are either in quarantine or in isolation in many hotels at the moment.
What kind of services would be available for those people?
So I always say that anyone who's struggling should call Lifeline, which is 24 hours a day, and they offer a counsellor service to anyone who calls up. There's also other numbers you can call, and that's probably the best first step. Mental health triage on 131465 basically provides, again, a 24-hour service in South Australia, which is a bit like 000, but for mental health emergencies. But also don't undervalue the impact of just getting on the phone and talking to friends and loved ones. If you're struggling, reach out, talk to somebody, let them know, and if they make contact with a GP or another health service, we can probably look to try to put some supports in place.
And for the rest of us who are allowed to at least go outside and get some exercise, how can we balance remaining cautious while still doing activities we enjoy during this time?
Yeah, it's a good question, and I think it comes down to just exercising a little bit of common sense, but also just making sure you're aware of what the guidelines are. I think a lot of people are getting worried that, guidelines are changing quickly. It must mean that things are changing or there's misinformation being put out. But look, the reality is we've never been in a situation like this as a society, or Australia has never had a pandemic response like this before. Keep up to date with what the recommendations are. At the moment, it's as simple as stay at home unless there's a reason to leave the house, and there's good reasons that have been published through various media channels as well as on the SA government website. And if you are sort of out exercising, the social distancing and wearing a mask, if it's appropriate, is a really good way of just protecting yourself and other people as well.
All right, were there any final other thoughts or comments that you'd like to add?
Look, I think my message to everyone is just be kind to yourself and be kind to other people. This is a really big time. I know myself personally, I'm on here talking as a GP, but I'm also human and I'm affected by this just as all of us are. I know a lot of my colleagues in medicine, we all feel this year has been an absolute whirlwind, and we feel the burnout just as much as everybody else does as well. Remember, this is not an easy time on anyone. Everyone is feeling the stress in different ways. Be kind to yourself, reach out for help if you need it, and just look out for each other as well.
Wavelength, sparking the convos about Adelaide you should be having on Fresh 92.7.
Thank you for that, Amila. We've got more about the COVID-19 crisis coming up after the break. You're listening to Fresh.
Wavelength.
Welcome back to Wavelength, sparking the convos you should be having with your host, David, this evening. Well, it's been a wild few days, to say the least, with the onset of this new Adelaide cluster. Among the news, you may have heard that the Parafield Cluster was a new strain of COVID brought in from the UK and unseen in South Australia until now. Our reporter Arj spoke with Deputy Chief Public Health Officer Dr. Emily Kirkpatrick and Professor Adrian Esterman from the University of South Australia to discuss the new strain and what it means for South Australia.
Wavelength on Fresh 92.7.
So Professor Spurrier talked about this new strain of COVID that South Australia hasn't actually seen yet, but it was seen in other countries, and this was actually brought in from the UK. What can you tell me about this new strain?
So what we've been able to uncover with the genomic study, this particular one, is that there has been a shorter period of incubation time. So that's the time after exposure to then the time of them developing symptoms. Because we know where this virus came from, we've been able to quickly go out and test people. So we picked up people before they've even developed the symptoms, and yet they've had that positive COVID result. And we know that some people can be asymptomatic with no symptoms for a couple of days before they then develop the COVID symptoms.
Now, how many strains of COVID-19 are out there? How many have been identified sort of globally?
Well, what we know with COVID-19 is there's many different variants of the virus. So not so much it's the strains, it's more the variants that we're seeing. And there have been many different variants that have been identified. And certainly it is something that we'll be monitoring from a scientific perspective and from a virology perspective to see, well, what happens now going forward, and particularly from a vaccination point of view.
So that difference, say, between the Theberton cluster, which we identified to Victoria, and the November 2nd cluster, which we've identified to the UK, what can you tell us about the differences between those two variants?
Well, essentially, they're both COVID-19 viruses, but the difference that we're seeing with that is how the genomics then link back. So they've come obviously from different areas globally, and they have undergone changes based on who's been exposed to it and who's passed it on. So that's one, I guess, the key things with virology is then understanding how the virus then passes on.
Wavelength.
Professor Esterman has worked across multiple fields as an epidemiologist, including the South Australian Department of Health, as well as at the World Health Organization. He spoke to Arj about this new strain and what it could mean for developing vaccines.
Professor Nicola Spurrier talked about this being a new strain of COVID. Have we jumped the gun here?
My understanding is they've done a genomic analysis of the virus. They had to do that so they could work out which of the various people in quarantine had originally brought the virus in. So they do know the genomic structure of the virus, but that's not been released. So until that's been released, we really don't know whether this is a new strain or not. But it would be very unlikely to be a new major strain because it would have been in all the scientific journals if there had been one. So this is an RNA virus. So all viruses either are made up of either DNA, which is double-stranded, or RNA. And RNA viruses are things like influenza, and RNA viruses are much more likely to mutate than DNA viruses. So we know that this particular coronavirus, the SARS-CoV-2, is an RNA virus, and because of that we know it's likely to mutate. Now, influenza has something called genetic drift, and that means every few months there's a slight genetic change in it. And then sometimes you get a genetic shift where there's a major change. So genetic drift means that if we are vaccinated, we'll still have some immunity. But when there's a genetic shift and a major genetic change, then we have to have a totally new vaccine because we have no immunity whatsoever against it. When we come to the coronavirus, the SARS-CoV-2, we're only seeing this drift. at the moment, and we don't expect there to be any major shifts, at least in the foreseeable future. Even when there's a genetic drift, so there's a minor change, the vaccines could still be tweaked to attack that particular drift. It's just you don't need a totally new vaccine. So what I'm trying to say here is that the existing vaccines that are just coming onto the market, like the Pfizer one, should be able to tackle the current strains of SARS-CoV-2.
Wavelength, sparking the convos about Adelaide you should be having on Fresh 92.7.
Thanks for that, Aj. After the break, we're going to be asking whether Australia's approach to hotel quarantine needs to be overhauled. You're listening to Fresh.
Wavelength.
Welcome back to Wavelength for our very special COVID-19 edition. So Adelaide's COVID-19 outbreak came from one of our Medi hotels, much like the spark that sent Melbourne into lockdown for months on end. We've been told time and time again from health authorities that these facilities are safe and protect the local community, but clearly they're not watertight and leaks do happen. So does the hotel quarantine program need a total overhaul? Jamie spoke with Catherine Bennett, Chair of Epidemiology at Deakin University, to find out what other options we have.
Hey guys, Jamie here, and here we are again. Adelaide's second lockdown, with the strictest restrictions Australia has seen since March, is a sign that we need to take our hotel quarantining a lot more seriously. I talk with Catherine Bennett, the Chair of Epidemiology at Deakin University.
I'm Catherine Bennett. I'm the Chair in Epidemiology at Deakin University. And, our role is to look at the distribution of disease and disease risk in the community. I work particularly with infectious diseases, and community transmission is my specialist area. And through COVID, I've had involvement in a few projects, including looking at excess deaths, looking at the evidence behind policy, but also had a pretty large role in helping people understand the language of epidemiology and what the numbers mean in these case counts we keep hearing about each day.
What is the sign of a rapid and strong healthcare system?
Looking at how many contacts have been communicated with and asked to go into isolation so that their status can be assessed, and also it reduces risk of those people passing it on. And that number was 1,000 one day when this first started to break on the 17th, and by the next day it was 4,000. So again, that's a sign of a really active public health response.
Is hotel quarantine the safest way to prevent community transmission?
Our main concern now, as we do bring community transmission under control, is reintroducing the virus with our return travellers. So we have to find a way to bring our travellers back and to make that a really good protection measure that both brings people home safely, but also the workers stay safe, and that we don't get the virus crossing back into the community.
What are some other options other than hotel quarantine? Why not something like Christmas Island, for example, to isolate?
Well, this certainly has sparked that whole conversation again. So looking at the possibilities of a remote centre, the challenge there is also having the high-level medical support you might need. If someone gets the virus, they might be okay for a week or so, but if they're going to develop serious illness, it can happen quite quickly, and you don't want to have someone in such a remote setting that you can't get them to a tertiary or quaternary hospital that's got all the facilities they need.
What is the quarantine staff COVID testing protocol at the moment?
So I understand there was no national guidance on testing of staff in these hotel quarantine or Medi hotels, and that actually surprised me. I thought there would be at least a minimum standard of testing. In Victoria now we're doing very regular screening of workplaces that are high risk, and you'd think the hotels would be on top of the list. So they might be tested in Victoria as part of that, but apparently we didn't have a national guideline.
Do you think that this testing is enough?
I think one of the things that we've introduced is using saliva testing as a way of collecting the samples rather than the nose and throat swab. And they've done that because it's a test that's more tolerable for people, particularly children or people having regular testing. So if you did something like that rather than the swab test, then I'd be saying test more often.
If quarantine staff have to work multiple jobs to survive, do they need more support, and what do you think that support looks like?
Yeah, these are really critical jobs, and I think we have to recognise them as that and make them a high enough level job that comes with expectations around training. It might also come with then expectations about this being your sole job so that you don't work in other places. And to do that, you do have to remunerate people properly. And so we have to take these roles seriously. We have to support the people in them with training, and also, managing the salary associated with it so that these people can focus on this and keep it as their own job, whether it's a cleaner, someone doing the kitchen work, or it's, nurse on site. All these people need to be able to be focused in one workplace so that they're not moving between different workplaces. At the end of the day, it might also be that they provide accommodation so that workers, just like they did in Melbourne for a time, can go and stay in a hotel themselves. They're not going home to their family every night. And that's a big ask. But again, if we pay the job well enough, people might be willing to do that. And it just helps break that bridge that happens at the moment between the hotel person and their family, as well as the wider community, particularly if more workplaces are involved.
Wavelength, sparking the convos about Adelaide you should be having on Fresh 92.7.
Thanks for that interview, Jamie. Some really important things raised just there. What stands out to me is the fact that a hotel quarantine staff member had to work a second job, which is insane to me. It's hard to believe that someone working on the front lines of this pandemic is not being paid enough that they need a second job. The program is clearly flawed, and in addition to reconsidering whether we need to divert away from Medi-hotels and focus on other programs altogether, we should be addressing the elephant in the room that is the casualisation of our workforce. It's why the outbreak in Melbourne got out of control, and it also meant a longer lockdown for here in Adelaide. Much to ponder. Anyway, coming up after the break, we've got some good news for you guys, but right now you're listening to Fresh.
Wavelength.
Welcome back to Wavelength, sparking the convos about Adelaide you should be having. Well, after the week that has been, we all need something good to think about, which is exactly the purpose of our weekly segment, Heaps Good News. Here's Adrian with the goods for you.
I know there's gonna be
Heaps Good News on Wavelength.
I think it's fair to say that we've just had a really strange week. After some pretty hectic ups and downs, what better way to start a new week than to rejoice with our Heaps Good News segment? So without further ado, here are some good news. Swiss Parliament gives dress rule the cold shoulder. In a move described as a small revolution, Switzerland has overturned a ban on women showing their shoulders in Parliament. The dress code was in fact only implemented 4 years ago, after a female news journalist was removed from the chamber for showing too much flesh. The reporter's attire had, quote-unquote, unduly restricted the ability to concentrate of many of the nobility. Luckily, this ban is now history. Moving on, NASA uses supercomputers and AI to count Earth's trees from space for the first time. To get a sense of how much carbon the Earth can store and how it changes over time, scientists would need to count the staggering number of trees that Earth has and track their growth over time. Incredibly, the folks at NASA are now using supercomputers to do precisely that. They found that they could not only count the trees that satellites had failed to see before, but also they begin to assess the carbon storage potential for those trees at the same time. With the right training in place, a job that may have taken trained eyes several years to complete took only a few weeks for artificial intelligence. Next, the UK brought forward a ban on petrol and diesel cars. Smut-belching internal combustion engines are reaching the end of the road in the UK, where the government has brought forward to 2030 a ban on new petrol and diesel cars. The UK now has one of the world's most ambitious targets for phasing out petrol and diesel vehicles altogether. Now some medical good news. The second coronavirus vaccine is showing encouraging signs. Hopes that the world will soon emerge from this coronavirus crisis were further boosted this week with the positive news that the vaccine developed by the University of Oxford triggered a strong immune response in adults in their 60s and 70s who are among the groups at most risk from the virus. It follows last week's preliminary analysis of another vaccine which was found to be 90% effective. Trials are incomplete and more data is needed, but the news has been described as encouraging by researchers. And while we're still on medicine, Canadian scientists believe that they've found the cure for diabetes. Scientists in the University of Alberta just cured diabetes in mice, opening the floodgates for research on adapting it for humans. The potential cure is a landmark moment in preventing the growing prevalence of diabetes in our society, a disease that burdens 422 million people worldwide. The process involves a stem cell application that reverse engineers insulin islets out of blood cells.
Wavelength, sparking the convos about Adelaide you should be having on Fresh 92.7.
Thank you, Adrian, and thank you, Adelaide, for listening to this week's show. You can listen back to any of our stories on our podcast on Apple Podcasts, Spotify, or wherever else you get your podcasts. We'll be back next week with a more regular show, but in the meantime, stay safe, Adelaide, and be proud of what we've been able to achieve in such a short period of time. And while that does bring us to the end of tonight's show, we did have one last question remaining. What was Zac Efron doing the entire time he was in lockdown in Adelaide? Amila, looked deeply into her soul and has written this beautiful poem. We're going to close out the show with this one tonight. Can't wait to see you guys next week. You're listening to Fresh.
He touched down in Adelaide, ready for the start of something new, but he got locked in and gold turned to blue. Before it went south, he hung out in Crybaby, chugging pints into his mouth like he lives here on the daily. Then we worked out the lies and the city broke free. From the panic, the worries, there would be tragedy. So we thank the police, SA Health are our heroes. We wait for the moment the cases become zeros. Most of us will act calm while others worry maybe if we are truly free to walk safely.
Wavelength.
Are you a podcaster? Maybe you've got that big idea and you're looking for a network to join. The multi-award-winning Ozcast network can get your content to eyes and ears all over the world. Join now for the first month free, and you could be featuring this sound at the beginning of your podcast.
Ozcast.
Simply head to ozcastnetwork.com for details.